fibroids. Do you know what causes fibroids? Because fibroids are now concerned within the country. Do you know what causes them? Do you know how we can prevent them? Ladies who don't want to deliver, you are putting yourself at risk of developing fibroids, uterine fibroids. These uterine fibroids, if you don't want to deliver or you produce like 1 or 2 children only, you are putting yourself at a risk of developing fibroids. What are these fibroids? Fibroids are non-cancerous tumors that develops in or outside the uterus. Yes. Which risk can put you to develop fibroids? One, we have those ladies who don't want to deliver. Ladies, you deliver. If you don't want to deliver, you know you're putting yourself at a risk of developing fibroids. Or you produce like 1 child, you are putting yourself at a risk of developing fibroids. Then we have heredity. If your mother or your grandmother had ever had fibroids, you have also high chances of getting fibroids. Then you have age. Those ladies at the age of 30 and 40, but most especially those who don't want to deliver. Then you have obesity, those very big mothers. How can you know that you are developing or you have fibroids? Actually, most of the ladies, they have fibroids, but they are not aware. You are there, you are getting medicines, you are getting what? If you don't want to do scan, you are getting treatment which is not right, because you might be having fibroids but you are not aware. So 75% of mothers or ladies, you have fibroids and you are not aware. Then we have menstrual abnormalities. We have ladies who join their menses and they bleed a lot. Then we have also those ladies who bleed irregularly in their menses. You bleed like today spot, after 2 days you also bleed, after 1 week you bleed. So that is a sign of fibroids. Then you have dysmenorrhea. Those ladies who feel a lot of pain when they are in their menstrual periods. That is also a sign of fibroids. Then you have dyspareunia. That is feeling pain during sexual intercourse. You feel a lot of pain during sexual intercourse. Most of the ladies with fibroids, they don't deliver. If you already have fibroids, it can cause you to have infertility. Then we have recurrent pregnancy loss. You have a pregnancy, if it reaches 2 months, it comes out. You develop another pregnancy, after 1 month it comes out. You have a pregnancy, after 4 months it comes out. The sign of fibroids. Then you have lower abdominal pain. Those ladies who always have pain in their lower abdomen, or pelvic pain, you have pain around this area, it is a good sign of fibroid. Then you have pressure symptoms. Pressure symptoms, you have those ladies who always urinate very frequently. For you cannot withhold your urine. After some time you go to urinate frequently, or difficult emptying bladder. You can urinate, but you feel your blood is not well emptied. Then you have lower back pain. Also, it is a pressure sign of uterine fibroids. How can we know, or how can we notice that someone is having or which test can we, or which investigation can we do to assess someone to know someone is having fibroids? One of the major signs is doing ultrasound, abdominal ultrasound. Those people, those ladies with abdominal pain, please first do abdominal ultrasound to check whether you have fibroid before you get treatment. Otherwise, you are going to be getting treatment, but you don't get healed. Because what? You are having fibroids. Then you have another investigation, magnetic resonance imaging, MRI. Actually, for it is more accurate than ultrasound. So those investigations can help us to see or to know whether you have uterine fibroids. If someone has already had or is having fibroids, which management can we do? Yes. If we already have fibroids, we take you in theater. We do surgical intervention. There we operate you. We can either remove those fibroids, most especially to those ladies who are still in a sexual productive age, those who still need to produce, there we remove fibroid. Or we can either remove the whole uterus, mostly to those ladies who are done with delivering. And remember that operation also have risks. If you delay and your fibroid, they become huge, they become big, and during operation, maybe we are removing those fibroids, there are a lot of bleeding which can cause death. You know you can die if you bleed a lot. So always go to health facilities when it is still early, when the diseases are still in their early stages. If you delay, whether you are a minister, whether you are an MP, whether you are what, fibroids, they cannot fear you if you delay to go for management very early and they are operating you. You have a lot of risks during an operation of fibroid. Then, as I'm concluding, I'm advising health workers, surgeons, and others, please, if an operation is major, don't lie to caretakers or a patient is minor. Most especially this myomectomy or hysterectomy, it is a major operation. If any other operation, if you are going to do an operation and it is major, please explain to the patient that this operation is major. Actually, you teach the benefits, the risks, and outcomes of an operation which you are going to do. Otherwise, you can tell a patient that this operation is very simple. During an operation, it becomes very big. When it becomes very big, the patient maybe can bear risks, maybe can die or can have like a long-term complication, yet you deceive the patient is a minor operation. Please, if operations are always major, tell people that operations are major, not minor. Thank you very much. We meet for the next video.